Hospital, Secunderabad. Dr. Ashish, thank you so much for joining us today. We will
Thanks
be
a lot.
discussing about everything about diabetes, but like we all know, India is known for festivals, and we are in the middle of the festive season, and there are so many questions and doubts with people having diabetes and having family members who are diabetic. So, Dr. Ashish, today we would like to discuss with you about what all needs to be done, how to manage the current festive times and indulgences, if you may, because we all have a sweet tooth. So let's take it forward. Why don't you, start connecting with the audience, and I will join in with some questions.
Diwali is a season of giving, so it's a really delighted that you have invited me to talk about it. Something which kind of affects every single family in India. With the numbers which are growing up, with 70 million diabetics around, a combination of Diwali and diabetes is not good if we are not working on it properly. So I'm really excited and happy, Shravani and Vivek, that you all have planned a discussion like this, which is very much needed for the present generation, and it is not for the present generation or the millennials. It's about everybody, because yes, it's we care. Diwali is about giving, and I believe we need to give the warmth of care and concern to every family member, whether he's active playing Diwali with us and firing crackers, or he is bedridden and he can only watch others enjoy the celebrations. So Diwali is means a lot to Indian subcontinent. What is Diwali all about? Diwali is about welcoming Lord Rama to Ayodhya, and that is what it means, a celebrations. But celebration should not end in disaster, because yes, there are a lot of sweets, a lot of excitement, a lot of people who come back from various places to celebrate this wonderful festival. And all these things, if we forget, how do we take care of ourselves or the ones who have diabetes around us, probably Diwali can turn out to be disaster. And that is what we are here for, to discuss it out. And I'm so delighted that we have a people like you who are always available to take care of each one of us whenever needed, with all the various gadgets and services available which are home based. And in COVID, the life has become the three things which we have learned, that yes, it's all about learning, unlearning, and relearning. So the online consultations are available, which make things much more smoother, where we do not have to go out, but rather everything is on the click of the fingers, through your gadget, through your phones, which we can do it out. So Diwali is a blessing to all of us. It's called as a Hindu festival, but it does bring smile to everybody's face. It does bring the season of celebrations in every single corner and a part of India or the Indian subcontinent. And yes, something which we celebrate even internationally. I've seen the President of America also wishing all the people happy Diwali, and that's why we all need to be connected to make sure that this Diwali or the Diwalis to come, they all remain celebrations and they don't end up with disasters which we've had in the past. A mismanagement of sugars, a mismanagement of excitement leads people reaching ICUs many times. And me, as an internal medicine specialist and diabetologist in Apollo, I have seen such things happening where we feel very uncomfortable. Playing with crackers lead to some kind of injuries. Uncontrolled sugars lead to heart attack, paralysis, kidney failure. And we do not take the warning sign, and then we get warning only when the person reaches an ICU. So with this note, I would want to tell my friends, with great power comes great responsibility, a very important saying. So with the great power of celebrating Diwali comes a great responsibility of taking people around us, the ones who have a diabetes. I like to discuss anything with a take-home message, an acronym, which will make sure that we remember what we discuss. As a diabetologist in Hyderabad, who takes care of sugar control for a lot of my patients around the globe. I would want my friends and everybody on the platform who's watching me live also to take this message with an acronym called as DIWALI, with a smile on the face, which Shravani will be having it because she knows me that I'm a man who like to give acronyms. This will make things clear and easier for all of us to understand. And D is for Diwali, and D is for diabetes, and D is for the attitude of giving. Do something positive during this Diwali. If you are kind of saddened because of COVID, if you're kind of saddened because there have been issues, problems at your home, then do something good. Anytime you do something positive, something which is brings smile on somebody else's face, or a selfless service, it controls your sugar and your blood pressure. You can't eat sweets because you have a diabetes. You definitely can share your sweets with the ones who can't afford to buy it. So do good. Like a philosopher, I may talk, but being a doctor, I know being good and doing good keeps your body fit and good. So do good and do believe in giving the food packets to the ones who do not have it. 8,000 people die every day because of hunger and they don't get food. You and me can bring smile and the blessings into the lives of the ones who are around us during this Diwali.
Dr. Ashish,
During, yes,
allow me to ask a question which is relevant here. You said a lot of us who are diabetic may not be able to eat sweets, and instead, this Diwali, try gifting them. Now, that's a question a lot of us have because we have family members who have diabetes. So, answer it once and all for all of our sake. If I am a diabetic, can I have sweets? How much is too much, or should I refrain completely? Can I indulge, or absolutely no, no?
a very tough question, Shravani, and you're very known for asking those kind of questions. The answer, if I go to my basics, is strictly no, no. You've heard me correctly. And I don't want to be harsh, that is tough for us to follow. I've had a mother who was a diabetic and she used to be loving ice cream and sweets a lot. So it does tough situation to address. It depends which category do you fall in. Are you a pre-diabetic? Are you a type 1 diabetic? Or are you a diabetic mellitus with diabetes? That's what we need to check it out. Are you one with a renal failure, or are you a one who have got any other complications available with you, and are you an insulin dependent completely? These are the issues which we need to know. I'll be very happy to address it out if you would want to connect me anytime. Otherwise, do keep a glucometer next to you. We all need to know, if we want to play around with our body, we need to do it responsibly. Every single bite of a sweet does increase your sugars, and that's what we need to handle it very carefully. And if you're an insulin dependent, and if you're taking the insulin 3 to 4 times in a day, depending what kind of brands you are on, there is a possibility that there will be a sudden swing of your sugars, which we believe isn't good for you, and you need to keep in check on it. Having a facility like that of CGMS or FSGS, where you have the continuous glucose monitoring, if that is with you, that will be a big blessing. It's very easily available, and you need to be having it, which gives the 150 readings in the whole day, or 200 readings with a tap of your gadget on the shoulder or wherever you have put a mark, this thing. But ask me very honestly, in a way, diabetes, direct consumption of sweet is no, no. I
Okay.
hope that answers the question. Yeah.
Okay. Then what do we do? How do we celebrate Diwali? Is sugar-free sweet still an option?
Shavani, the thing is, what we need to understand is celebrations are not only about eating sweet. Celebrations and making sure that you feel good about it. That's the reason I was talking about do believe in giving, because yes, smile on others' face do give you smile on your face. But if you want to indulge in the act of eating something and giving into the temptation, you know, do be doing it cautiously. And that's where my next acronym comes. D is do believe in giving. D is drinking. No, no. Diwali is a time of celebrations, and Diwali is a time when there is a lot of smoke. So try keep yourself safe. No drinking, no smoking, if I can tell my friends. And then drugs procurement. So remember these D's. Make sure you have the medicines in extra in your hands, because suddenly one tablet missing, and when the tablet is missing, it very commonly happens in Indian scenario. And then you believe not only that you have missed the tablet, you already consumed sweets, so your sugars have gone up because of absence of tablets, and then it causes a disaster because you're having sweets. So that is what the first D is all about. And next is I, and probably I would need your help with this I part of it. I is about investigate yourself. Check it out. When did you do the last blood test on yourself? Especially HbA1c, creatinine, and TSH. And lipid cholesterol should be done once in 100 days if you want to live for 100 years. And that's why probably I would ask you the question directly. Are you available to pick up the samples right now also if somebody texts you messages, or you can make sure that it is done by tomorrow morning if somebody puts it? Because yes, the only one scientific way I can keep my friend out of hospital if he or she does his labs regularly. In India, we try to avoid investigation. We believe it's a waste of money, and we learn the lesson only by reaching an ICU. So regular investigation is very important. If any one of you who's watching me live right now haven't done those bloods or the tests at HbA1c, creatinine, TSH, lipid profile, then please do it now. There is still time of 36 hours before the Diwali is hardcore inside, so that we know where we are. Is it HbA1c of 15, 16, 10, 20, or is it HbA1c of 6.5 or 7? Because we need to maintain HbA1c, which tells us about your sugar control in last 3 months. And that will help me in giving you liberty, how much you can cheat on yourself and eat sweets. So I is for investigation. And at this time, I would ask a straight question to you, Dr. Shravani. Do we have the lab sample facility which can be picked up from home, and where all do you serve from the clinics?
Yes, yes, Dr. Ashish, thank you so much for bringing this up. And yes, investigations and timely periodic investigations are the key to contain this epidemic more than the medications. And a lot of times we don't get those review tests done on time because, like you rightly said, we think it's a waste of time. And ek baar karwa liya to it's done. So here's to everybody who's attending on behalf of Click to Clinic today on the eve of Diwali and the eve of World Diabetes Day that's ahead this Sunday. We have a 10% discount available for everybody who's trying to come in for any diabetes lab tests at C2C. Now, I'm going to put in the free toll-free number in the chat scroll as well. You're most welcome to go check out Click to Clinic website. That also I'm going to put in the chat box. We will be available 24/7 to come to your homes where you are and in the comfort of your homes to pick up a sample for testing so that you can get tested. Before Diwali, we know where you stand. And probably once you enjoy the celebrations, you can get connected to your consultants for a timely review to manage your sugars and manage your diabetes as well. So yes, Dr. Ashish, we are available. And we are here to serve at the comfort of everybody's home. So if somebody is looking at a sample, here's the details in the chat box. Please go ahead, Dr. Ashish.
Thanks a lot. So D is for to believe in giving. It's drinking and smoking to be avoided, drugs to be procured, and deep breathing exercise. When there's COVID season, we get infected primarily because we are not doing exercise well. So today, tomorrow, when soon there'll be a lot of smoke, do take a deep breath out win your own clear atmosphere and take a deep breath and do the regular exercise, because your lung, which is stable and happy, will make sure that you breathe happy. So that's a D part of it. I is investigations to be done regularly. Investigate more and more. My dear friends, Johnson and Labanson and everybody else who is listening to me, I would want to tell you there is one very, very wrong connotation called as unnecessary test. If I need to make sure that you live for 100 years, I will have to do more and more tests because I'm not a magician, I'm a doctor, and only the labs tell me which condition are you in. So do investigate yourself regularly. And I is also for your insulin. Make sure that you keep your insulin next to you. Make sure you keep a proper stock of your insulin, which is very much needed. And we do not keep it, or sometimes it gets lost, or sometimes the pen gets broken during the Diwali time, and then we say, "Chalega, let me have the celebrations, and I'll buy the new stuff later on." No, a strict no. Keep an extra stock of insulin, keeping extra stock of drugs and the medicines is very much important, and that's what I would want to leave with you. The W stands for worry less and walk more. If you are a diabetic patient and you have got any issues where you're concerned about my sugar control, buy a glucometer, have a sugar device at your home, and when in doubt, check sugars, and that usually does the work, which is very great. You want to be very, very meticulous, and if you're cheating on yourself and having small sweet, you would want to be checking what is the calories which are there in the sweet. Google will help you out very, very easily. And the time you take a rasgulla and you find it is 25 grams, which is going to give me 100 kilocalories of sugars or the calories. Walk more, walk those many steps. You're consuming 200 kilocalorie extra. Feel free to do at least 200 steps of exercise during this time. You know what? Diabetes needs four things to control sugars. Remember the acronym DIET, that is diet. Number one, you control sugars 25% with your diet. I is through insulin. Every diabetic requires insulin. In initial stage, type 1 diabetes mellitus, patient requires insulin right from the beginning till the end of the life. In case of type 2 diabetes mellitus, whenever your doctor says that you need to be on insulin, please take it. Delay is not a great idea, and your doctor decides the best. E is for exercise, and T is for tablets. DIET, diet, insulin, exercise, and tablets. And that's what I would want to tell you, that walk a little. Every kind of small exercise helps out in controlling your sugars, and that's what I was talking about. DIW, and W is for worry less and work more. Worry less, why? Because with worry you cannot add 1 second to your life, but with worry you definitely can decrease your lifespan. Because with worry you give me the good business by having more uncontrolled sugar and uncontrolled blood pressure, and you do not get benefited at all. If you have a worries, talk to us. We are available. I am available, Dr. Ashish Chauhan, at 810-612-7475 for any online consultation 24/7. I may take time to respond, but I will always respond. Besides me, I'm very sure your own doctor will be available every time for you. And with that, worry less and walk a little or walk more is something which I would want to tell you. Walking is the fourth best exercise, which we all should do it regularly. How much? On a rough basis, 10,000 steps per day. We all have our speedometers on our smartphones. Please calibrate it accordingly and make sure that you at least walk 10,000 steps per day. And with more consumptions of something sweet and oily stuff, high calorific intake, increasing that to some extent is something which is very needed. And walking not only controls your blood pressure and sugar, it keeps your healthy heart very well, to make sure that your heart and your lungs give you life for another 100 years.
Dr. Ashish, allow
Coming
me
to
to
the
come in
fourth,
here
yes, please.
with a couple of interesting questions. Number
Thank
one,
you.
you've told us very clearly that sweets are a big no-no. Second, you said try and monitor our own sugars if we are known diabetics, or all the more if we are on insulin. Now, continuous glucose monitoring is one thing. Having a glucometer bedside is one thing. And a lot of times we or our family members don't really get the concept of having a device at home. This is something supposed to be done at a lab, and why do we need to have it? And can you please enlighten us about why is it important for every diabetic, or for anybody in the family with some diabetics living, why is it necessary to have a glucometer?
The most important thing which you should have it at your home for a diabetic is a glucometer. The most important thing. Thanks for bringing that out, because there's nothing more important than having glucometer at home. And why it is, because I will address and make it pretty longer time, is a lot of people believe lab is superior than the glucometer, and I will say Wrong. Yes, you have heard me correctly. Glucometer is superior to the lab, and I will explain that to you. If we are doing the labs and the same sample is immediately sent for the analysis, then the lab is superior than the glucometer. How does the sugar is collected is you can give the home pickup sample at home, then the fellow takes it to the lab, which is consumption of lot of time of half an hour, 1 hour. There also they do it in the batch, and by the time we are doing it, are we able to maintain the temperature in the kind of temperature it should reach the lab? We are in Indian scenario that is slightly not available. That's why the glucometer which is available next to you at your home is the best. Which one is the best? Other than Chinese, I will say everything is the best, and I'll be very clear about it. Right now, we have found in our experience that few places 4 or 5 times during COVID time, kids also we were not happy with the Chinese answers to the company because we don't get the right kind of results. We believe we have a lot of international brands available, and is which one to go for it, which one is easily available, which you can depend on. How do we depend on any glucometer? Are we promoting any glucometer in particular? My answer is no. My simple answer is check your glucometer with the glucometer of a hospital. In my hospital or in the various my clinic, I tell patients to please bring your glucometer, and with the same drop of blood, check sugars in your glucometer and my glucometer and see how much the variation is there. So glucometer important is very much high. You all should have it. And why should you have it? Diabetes leads to be the reason where number one cause of kidney failure. The number one cause of kidney failure is diabetes. The number one cause of blindness is diabetes. So there are so many things with diabetes causes. And why am I bringing kidney failure is because whenever the kidney is affected, patient goes into severe hypoglycemia automatically. The low sugars are more dangerous than the high sugar. And if you do not have a glucometer, which you should be able to check sugars at 2 a.m., 3 a.m., you cannot get a lab person coming to you at 2 a.m. and 3 a.m. And high sugar and low sugar both have the same symptoms. You will have a chimta, pasina aata hai, you get perspiration, you get ghabrahat and all uneasiness. And all these symptoms are there in both with high sugar and low sugar. Having your own glucometer helps you in doing something immediately to save a life. So having glucometer at home is completely must for everybody, and having it calibrated by the qualified people is very much important. Let me again fire back at you, Shravani. Is there a way it
Yes.
is available? Somebody wants right now glucometer. I know in Hyderabad, I can make it available through my channels and sources. But for the people who are in different cities, can they have a glucometer delivery if they believe that they should buy a glucometer immediately for themselves?
Yes, Dr. Ashish, that's in fact is the idea, with which we wanted to address this, that if anybody is in need, we are here to serve it in the comfort of their homes. We are happy to deliver it to them. Like you rightly said, we are not promoting any brands or any institutions. We are here to promote better health. So if somebody is looking for a glucometer, I've put it in the chat box. You have a toll-free number and the website. Please reach out to us. Like I said, for everybody attending this session until 30th November, on the eve of World Diabetes Day this Sunday, we have a 10% off on every device that we are going to be selling as well. So please reach out to us, make use of the offer, and it will be delivered to the comfort of your home in the current crisis of COVID. You do not have to step out. And not just in Hyderabad, across the country, wherever you are, just give us a call and we'll make it happen.
Thank you, Shravani. Dear friends, if you have any of your friend, and Diwali is about giving. If you think he has got a diabetes, gift a glucometer, take my words.
Well
Gift a pulse
said. Bravo.
oximeter, take my words. Gift a blood pressure apparatus, that's my word. If you and me will not take care of health of each other and of our neighbors, who else will do it? It's our duty. A glucometer and blood pressure apparatus as well as pulse oximeter, which is very much important right now in the COVID season, needs to be gifted to show the true love and affection, and which is more meaningful than the sweet box which we do pass to the people around us. So
I think
please
that's a
remember that.
I think that's a very beautiful suggestion that you've suggested, Dr. Ashish. More power to you and bravo for saying that. You know, a lot of us believe that traditionally, if a certain thing is being done, like Diwali, it's sweets, you send a sweet box. But I think being cautious and caring about the people that you love, if they are, known cases of one of these conditions, I think there wouldn't be a beautiful gift, more beautiful gift than, like what you've suggested that would help them. So absolutely, I think this is a new suggestion we are going to take back from this session. Diwali Pay, if you have a friend or a family member with diabetes, the ideal gift would be glucometer. Yes, Dr. Ashish, please go on. You're on mute. You're on mute.
Okay, yeah.
Yeah, yeah.
So gift a life, gift a glucometer, gift a blood sugar, blood pressure machine, and a pulse oximeter, which I would want to tell all my friends out here. And then coming to the A part of it, DIW and A. This is very important. A is for aspirin, A is for atorvastatin, A is for ask for help. Ask and it shall be given. If you are uh, having any kind of symptoms anytime, feel free to communicate. Remember one thing, the first minute, first hour is more important in handling any kind of crisis. For all my elder friends, senior citizens out here, do not hide your symptoms, or if you're feeling uneasy with your friends, assuming that you will spoil everybody's fun at this time. We love you and we would want to hear from you. So ask for help. Anytime you have any uneasiness symptom, any ghabrahat, you're feeling ki haath pair thande pad rahe hain, any kind of numbness, any kind of sudden onset giddiness where you're not okay, ask for your help. Number one. A is for atorvastatin. Atorvastatin is a drug which is very much needed for the heart as well as for the brain attacks, and it should be taken for anybody who is 40 years of age. We believe it is drug which will decrease cholesterol and can be taken one extra tablet if you believe you're going to be cheating and you may end up eating a bit high calorific food. So if you are on atorvastatin, which is usually doses 10 to 40, which were given by your cardiodiabetic specialist, if you think you are having something oily food, I wouldn't mind suggesting take one tablet of 10 milligrams extra. The dose is 10 to 80 milligrams. If you're on 10 milligrams, having an extra 110 milligrams of tablet is fine. Now, a lot of doctors disagree or have a different kind of assumptions for it. I would want to tell you, whenever you get a heart attack, paralysis, then the first thing which is very much effective is a high dose statin. And that's why I say that anytime you're taking a bit of kind of casual and you are going on yourself a bit uncomfortable and you may eat anything, having one extra tablet of atorvastatin can be helpful, is what my personal thought. Number 3A is aspirin. If your doctor has told you and put you on aspirin, make sure you have it and carry it and take it regularly. Same thing about anti-diabetic agents, same thing is about antihypertensive agents, and you need to be remembering this. Finally, L is for laugh out loudly. Staying happy, making sure everybody around you is happy and you being happy is something which will control your sugars very much. And that is what I would want to remind you.
One question
Final word.
here, Dr. Ashish.
Yes, please go ahead.
One question. In the festive season, we've seen it with Dashera, Navratri, Diwali, and all the festive seasons, be it the Lent, whatever you call it. Fasting is inevitable. It is in all our cultures. And one thing that comes up every time in a diabetic household is should we fast or not fast? Can you please comment on this?
You've asked a tough question again. For in my personal, fora, which I believe, diabetic means no fasting and no feasting. You've heard me correctly. No fasting and no feasting. So especially the kind of Ramzan kind of fasting when people don't take water also for 8 to 10 hours, There are a lot of fluctuations which happen, and patient can go into hypoglycemia. 30% of the diabetic patients who do the Ramzan kind of fasting, they go into hypoglycemia, which is not good for them. Once a diabetic, always a diabetic. I don't think you should play around with your body. You have asked such a tough question, because I would want to tell you, lot of people have a different thought process. They say, I can do this, I can do that. Your body is already a diseased body, and having so much of fluctuation, glycemic variability, because of taking tablets, because of eating food which is not being controlled by your insulin. That's why you got diabetes. On that, if you want to give a physical insult to your body by going into sudden too much of fast, I think you need to be responsible. I would be very, very crystal clear. In my practice, I tell very much no fasting and no feasting, and I stick to that. A lot of people try that out, and the only way which they can do it is again by having a continuous glucose monitoring system, CGMS, or having a glucometer at home. But there is a lot of patients I have seen who have gone into DKA, also diabetic ketoacidosis, where patient is stressed out. Stress also increases sugars. So why to have a stress? Stay happy, stay healthy, and stay blessed is something which you need to know. And fasting is, I believe in any kind of religion, God wants your sincere heart and the prayers, rather than your fasting and adamant about doing something which is going to be harmful for your body. Personally, no fasting, no feasting is what I would want to suggest to my friends and viewers and everybody out here.
Thank you so much for answering that, Dr. Ashish. I have another attendee asking an important question. So, for somebody who's on insulin, a type 2 diabetic who's on insulin, the question in the fight always is, will I ever get off insulin? And the same, I think, applies to people who are on OHAs as well, on oral antidiabetics too. Will I ever be able to get off these pills? The idea is the $1 million question: can I manage it with diet and exercise and get off the insulin and get off the pills? Please answer it for us.
That's a very good question. Yes, probably the answer is again yes, and probably the answer is no. We need to understand one thing is, the diabetic is a very, very complex disease and has got a very huge pathophysiology behind it. How do we define a diabetes? There is an insulin resistance which comes because of obesity. That's why we call it diabesity, which is what type 2 diabetes mellitus is all about. And then there is insulin absence. There is no insulin in your body, and that's why you have type 1 diabetes mellitus, and you definitely require insulin in that body lifelong. Now, the way to control sugar is DIET. D is diet, I is insulin, E is exercise, T is tablets, 25% of each. Whenever we want to decrease only and only controlling diet and exercise, you can do it in the pre-diabetic time, not during the time when you're over diabetes. If you do not take the medicine for some time, your sugar can be controlled. There's something called as even honeymoon period also, where once you are diabetic, but then once there is a bit comfort to the beat your islet cells, and your islet cells recover from the insult, and you become normal for some time, 6 months, and you get the feel, a pseudo feel, that my sugar got controlled because of my diet and exercise. My answer is no. You need to be depending on all the four things, and you need to listen to your doctor's advice. Say your doctor is the one who knows your structure in and out. If you're going regularly to him, any kind of bargains which you want to do it, he is the right person who has to help you out. He's the right person who will tell you how much of cheating you can do it, how many rasgullas you can afford to take it, because he will tell you, do this much adjustment in your insulin. And he knows your creatinine level, because with renal failure, with your cardiac status, your bodies respond to the insulin changes. Every insulin has got a different longevity of action, and that your doctor knows it, whether you are on a long acting insulin or you're on a short acting, or you're not, both together. And your doctor will tell you how much adjustment you can make it. But if you want to try of leaving tablets and insulin completely, My answer will be that will be a risk to take it. And I'll give you an analogy. You're going on a cycle. I used to do it when I was a kid. And once you're going very smooth on the cycle and you find there's nobody in the way, you leave your hands from the handle and you go to the cycling without holding the handle. हवा में हाथ उठा करके you are cycling the cycle, and then you realize you feel very happy. Oh, I can able to drive. I can cycle it for 10 meters, for 20 meters, for 50 meters. That's what will happen if you stop the insulin or tablet, that your sugars will be controlled for some time in between. And what happens when you continue further is accident. So that's what usually happens. And my answer of playing with your medicines, playing with your insulin is strict no. You need to be taking your help of your doctor, and he will help you out. And even if you want to try something, I think he's the right person who should be taken into confidence. And with his help, probably can do these kind of error and trials. I would tell you very honestly, enjoy life. Your body needs to be worshipped, to be taken care of appropriately, rather than you doing your own, kind of Googling and deciding how to handle your body. At this time, I would want to request, with a lot of request and humility, I would want to tell you, please do not compare your 20 minutes of Googling with 20 years experience of your doctor. 20 minutes of Googling cannot be equated with 20 years of experience of your doctor. So listen to him, trust your doctor. If you cannot trust your doctor, move on, see another doctor. Anybody is fine. Who is the best doctor? One with the big degrees, MBBS, MD, DM? My answer is no. The best doctor is one who you trust the most. The one who you trust will give you the best results. I
Dr.
hope that
Ashish,
answers the question.
yes, it does. And one more interesting question coming in, Dr. Ashish. In the current times of COVID, we've all seen how the lockdown has, put us all into our holes. And one common question that is coming up is we have bigger issues to deal with, wherein we are worried about contracting COVID if we get out, or if we walk into a hospital, we might get infected. That's a bigger risk for us or for our parents or elderly in the family. Why should we worry about getting tested for diabetes or getting the medications out? Why should this be a priority? Can you explain how in the current times, of course we discussed about telemedicine and how everything is possible virtually today, but also the mindset is when we have a bigger risk at hand, something like COVID, should we be really bothered about diabetes and getting my HbA1c checked every 90 days? Should I be worried? You're on mute, Dr. Ashish. You're still on mute.
Yeah.
Yeah.
I would want to tell you something personally. Okay. A lot of things, even when it's about the management of medicine is, or diabetes is, lot of things depend on your attitude. You can curse COVID when you want to, or you can take it as a blessing, because COVID did what whole world could not do it. The COVID equalized the whole world. COVID did not make any difference between the rich and the poor and everybody else. COVID passed the message that yes, work from home is good, and a lot of IT companies are very happy about it. Lot of medicine management can be done through the online consultation, which we never thought it was a great idea. And COVID has communicated, which I have been promoting from last 20 years. Hospitals are dirty place. Yes, they are. That's a confession which I am doing it, and I'm very sure most of the people know it. It's just that we don't discuss it out. One of the most infective places on the earth are the hospitals. And yes, you need to stay away from hospitals as much as possible, as per the advice and the guidelines given by your doctor. So stick to WhatsApp consultations or video online consultation. Take advice of your doctor and do investigations at home, as well as get the drug delivery through various apps which are available. I'm an internal medicine graduate, postgraduate from CMC Vellore as well as from CMC Ludhiana. After having done a diabetology and I see majority of my patients, I have realized, and I would want to tell everybody, 90% of the times I feel very happy and I feel very easy to do the online consultations, and I do not need patient to come to me. When it is needed, I will be very happy to request you to come and see me. Otherwise, take the consultation online and stay happy, stay healthy, and stay blessed at home. Don't get exposed yourself to COVID as well as swine flu. The final I is about influenza shot or the flu shot or the pneumococcal vaccine, which all of you, the ones who have a diabetes, should take it. The ones who do not have diabetes also should take the flu shot. And all these things, you need to remember one thing: excess of anything is bad. So staying too close to hospital is bad, too far away from hospital is bad. And who balances that is your doctor, as well as your spouse, who will give you the right advice at the right time. So make sure you take WhatsApp and the video consultations, and make sure that investigation are picked up from home. Because just because you don't want to come to hospital, not doing investigation is dangerous for you. And uncontrolled sugar, unwatched renal failures, which does happen, and the other various disease like that of thyroid and cholesterol, which go hand in hand, will damage your body, and you will suddenly become too sick to reach the ICU. At this time, I would want to tell you, meet or whatever, connect with a doctor when you do not need him. See a doctor when you do not need him, and you will never need him. Whenever we are waiting for some symptoms to come and then we reach a doctor, we are already late. Diabetes can be present in any one of you who is watching this program, even when you are not diabetic, without having any symptoms. So don't play with the diabetes, don't play with your body. If you are in the diabetic capital of the world, if you, that is India, if you are in the diabetic capital of India, that is Hyderabad, check your sugars whenever there is an opportunity, and use the online portals to help you with the medicine and investigations at home. For anybody else who would want a consultation, my numbers are here. I'm very sure Shravani can help us out, everybody, to connect each one of us so that we can help you out at your home at one thing.
Dr.
Second thing, let
Ashish,
me speak one thing,
I,
Shravani, I would want to finish.
yes.
Um, if a patient walks into my chamber, I take 10 seconds to make a diagnosis. Take my words, 10 to 12 seconds, and I make a diagnosis. But when I give online the consultation, it takes me more than 10 to 15 minutes. From 10 seconds to 10 to 15 minutes. I would want to tell you, online consultation is tough. Pay your doctor properly, appropriately, and ask him repetitively, because quite often probably he is not addressing your queries, because not only that he is, it takes a lot of time, probably you're not paying him also. And in India, as a population, we don't like to do that. We believe that is not a good habit. As a family member of yours, I would want to sensitize you to this issue, because your doctor takes efforts. Downloading the reports takes time, reading those reports takes time, evaluating with your symptoms and reading those reports and give you prescription is a tedious job. Ask me honestly, I would want to see a patient 10 seconds in my clinic and write the medication, and doing an online consultation is a pain for me. So I'm very sure it will be tough for other doctor or the family physician of yours also. And over that, any hesitancy in making the fee will make tough things for you. Probably the doctors or the others may not even answer. I'm just clarifying it for you so that you understand what kind of stress or whatever kind of environment doctors go through. And during that time, please give him time to respond also, because I do online consultations while seeing an ICU patient also, so I'll take time to respond to the messages which I get on my chat box. I hope that clarifies things for most of my patients out here. Shravani, over to you.
Yes, Dr. Ashish, thank you. Another question that is coming up repetitively is, since we are all talking about the times of COVID, are diabetics more prone to catching a COVID infection? Are there any specific preventive measures that a diabetic should be taking?
SMS. Diabetics are definitely more prone to catch infections. Elderlies are more prone to get catch infections. Smokers and alcoholics more prone to get infections. If the diabetic happens to be a smoker, his chance of getting COVID becomes 10 to 20 to 100 times more. If the person is also elderly, the chances are more. How do we make sure that we save our family members, our uncle and aunties, mother and father and grandparents? SMS, what government authorities are telling us. social distancing, mask, as well as finally the sanitizer use. These are the three things which will keep us fit. If you have a diabetes, stay at home, stay happy, and make sure you enjoy the smoke-free Diwali, because crackers do cause noise pollution, as well as the smoke is harmful for you. But if you still want to burst your crackers, maintain distance and maybe see it from the glass where the children enjoy. But staying at home is the most important thing, especially when we do not have the 100% treatment for COVID or 100% vaccine available for COVID, which is not there. Along with COVID is the time when there are a lot many patients who got swine flu, as well as CAP, that is community acquired pneumonia. Please take flu shot. Please take pneumococcal vaccine. Please take DTaP and MMR, whatever is suggested by your doctor. That will help you in staying healthy. So do take a facility of home, based services, which will make sure that you have everything available at the snap of your finger, as well as with your thumb, to get everything at home. And that's why I am very much promoting, definitely, click to clinics, as well as every home care which we have it, so that I can have my society and my countrymen healthy and happy at home.
Yes, Dr. Ashish, our intention of conducting these patient awareness sessions is also, not just to share knowledge, but to give them a holistic understanding of what is possible today in managing our own health. It's not like before, wherein we need to rush to hospitals for everything. We have everything available at home on our smartphones. Best of the health is also one of them. One last question before we close, Dr. Ashish, is a lot of times diabetes is looked at as a single entity, a single disease, but you and I know that it becomes an entire gamut of other conditions that come along with it. You talk about obesity as a risk factor, but how closely hypertension walks by, how closely cardiovascular risk walks, how closely renal failure walks, you would agree. A lot of times diabetes is looked at as just, I have sugar, nothing else. Could you just throw some light on how a bad or a mismanaged sugars can lead to other complications, macro or micro?
Diabetes affects every single part of our body, right from the head to toe. We all know macro and macrovascular complications, that is a medical terminology, but I would want to tell you what does the diabetes cause maximum, and we don't even talk about it. Is number one is diabetes can cause DKA, where you will reach the ICU because sugars are very high. Number two is DIABETES. I will tell you very quickly. So D is for DKA, I is for infections. Diabetic patients get infections 10 to 20 times more than everybody else. A is for atherosclerosis, that means heart attack and paralysis. B is bowel abnormalities, that means you will have loose stools or constipations. I believe this is being recorded and you can check it out on Facebook also. So please write it down, and it is important for you. So B is for bowel abnormality. Diabetic patients have loose stools as well as or the constipation. E is for eye problems. People have retinopathy, people have a cataract, and number one cause of blindness in the world is diabetes. T is for toe involvement, or what we call it as a peripheral vascular disease, where the 85% of non-traumatic leg amputations, maximum numbers of leg being cut, is because of diabetes. E is for ESRD, or chronic kidney disease, that is number one cause of kidney failure is diabetes. S is for sleep disturbance. The number one cause for the insomnia sleep is diabetes. S is for sexual problems. Every diabetic patient, male or female, have a sexual problems. And S is for stress. Diabetes causes stress, stress causes diabetes. This is a whole vicious cycle which goes on and on and on. And what can break this chain is just making sure that you have glucometer at home, and you have somebody who is as caring as your own family member, who assures that person is taking medicines regularly, and the investigations which will make sure that you are fit wherever you are. So I hope with this acronym of diabetes, you get to know that diabetes affects every single part of your body, and you and me need to make sure that our sugars are controlled. This Diwali, make sure you and me have a disaster free Diwali. We have a Diwali where we spread happiness and we talk positivity. COVID and diabetes, we all can fight together with a lot of positivity.
Thank you for
Thank
answering
you.
that, Dr. Ashish. I think you've summarized that very, very well. The entire intent of catching up with everybody today is this Sunday, Saturday, day after happens to be Diwali, and incidentally, we are celebrating Children's Day this weekend, and we are also celebrating World Diabetes Day. And like you rightly said, we are living in the diabetes capital of our country in Hyderabad, and we are also really high on the burden of the disease as a nation as well. So I think the inputs given by you and the suggestions given by you, if I have to summarize, you're saying a big no to sweets. Instead, gift somebody something. And that too, while gifting, like how COVID has taught us this year, that let's be wise and probably gift something that will make a difference to their living and life. Maybe a glucometer or a BP machine, that might help them. And the last thing I think is refrain from unnecessarily going to medical facilities, but still continue to connect with your doctors, your technicians, and get your medicines delivered at the comfort of your home. So my humble request and invitation to everybody who's watching this is, we are happy to be conducting such sessions on behalf of Click to Clinic. The idea is to spread the possibility of the best healthcare at home today. That's what we are trying to do. We are helping you across the country, but if you're logging in from Hyderabad, we are happy to hear from you. 10% off on all lab tests about diabetes and equipment, and free counseling to diabetic patients is available this month on the eve of World Diabetes Day till 30th November. So please reach out to us and let us know if you need more such sessions, and let us know what are the topics you want to hear about. Dr. Ashish, a very special thank you to you for joining us today and giving your precious time. I know you've let a lot of your patients wait. So we're going to let you go. Thank you so much, and we'll see you soon again. Thank you.
Thanks a lot, Dr. Shavani. I'm so delighted. Diabetes kills 10 people every minute. So feel free to reach out to your doctor. I am available at Apollo Hospital, Apollo Secunderabad every day. And you can reach me out there or my clinic in Masaptang or at St. Teresa Hospital in Sanat Nagar in Hyderabad. But connect with your doctor to stay out of ICU. May God bless you. Thanks a lot, Shravani and the team. May God bless you, each one of you, and have a very blessed and the Diwali full of lights and celebration. Thank you. Namaskar.
Thank you so much, Dr. Ashish. Here's wishing everybody a very happy Diwali from Click to Clinic as well. We hope to serve you soon. Thank you so much. Bye, everyone.